Hello and welcome to Chapter 15, the Musculoskeletal System. So our last lecture, Chapter 14, I did it on the webcam and you guys seem to like that. So we're going to try this again. I'm going to try to make sure that I am doing this slowly and thoughtfully, and I'm not yanking you guys around too much, but I'm excited to try something new. I need you to get out your CPTs and I need you to go to the musculoskeletal system. If you have a 2020, it's page 111, 2019. I do not have that book here. I have that at home. It's my extra manual. And also you're going to need your step-by-step manual. I'm just going to put this here. Okay, so what I want to tell you is that you see these the 6 objectives here. This is what we're going to be talking about. But before we go into those objectives, I do want to point out that I want to go over with you the format of this section of your CPT, and that just means how it's laid out. The musculoskeletal system subsection is formatted by anatomic site, such as general, head, and neck. Then your subheadings are going to be incision, excision, introduction or removal, repair, revision and or reconstruction, fracture and or dislocation, arthrodesis, and amputation. Okay, so that is just in your step-by-step right here. The first thing that we're going to go over, our first objective, is actually going to be differentiate between fracture and dislocation treatment types. So we are going to get there, but I want you to open up your CPT manual to this to the musculoskeletal system. I need to move my mouse over. Okay, so all right, let me move it over here. I'm trying to get enough room so you guys can really see what I'm looking at here. Okay, so this is actually the very first page. And this is our glossary. It's going to give us page numbers and things like that of different sections of our musculoskeletal system. The first thing that you're going to see here is actually a diagram of your musculoskeletal system, of your skeletal system here. Okay, then on this page, you have your skull, and it gives you some great anatomy there. But this is really something that I refer to quite a bit. This is actually your vertebrae, your lumbar vertebrae, your L1, L2, L3, L4, L5. When we're doing some coding and you're thinking, okay, there's L3, where is that? Well, I want you to be sure that you can go here and then you can kind of look to see where it's actually located. Okay. Again, we're going to go through our glossary and, you're going to be looking through to see all these wonderful pieces of anatomy information you have. Then you have your muscle systems here. And then we're starting in our guidelines, our rules and our regulations. And we're actually going to be starting at musculoskeletal system. Now, I know that you guys can see this, but it's upside down for me. So I'm actually going to turn the book around and I'm going to go through some of the things you need to know, but then I'm going to turn it back and forth so you can actually see. So I'm going to turn it around here. And the first thing that I want to talk about is just the very first line. It's musculoskeletal system is in green. Let me pull it over here so you can see it even though it's upside down. Musculoskeletal system right here. This first line says cast and strapping procedures appear at the end of this section. Then I wrote page 182. So I'm just going to run through. Underneath it, it says the services listed below include the application and the removal of the first cast or traction device only. Subsequent replacement of cast and or traction device may require an additional listing. So it's already giving us billing advice. And then we have our definitions. The terms closed treatment, open treatment, and percutaneous skeletal fixation have been carefully chosen to accurately reflect current orthopedic procedural treatments. So you're going to find the definition to closed, open percutaneous skeletal fixation. So I saved this to do whenever we were together. I like to just highlight. And so, for example, I would read closed treatment. Let's read the definition and actually see if there's anything in there we want to make sure that we highlight. Closed treatment specifically means that the fracture site is not surgically opened, exposed to the external environment, and directly visualized. This terminology is used to describe procedures that treat fractures by three methods: without manipulation, with manipulation, or with or without traction. So that's everything you need to know about closed treatment. Open treatment is used when the fractured bone is either surgically opened, exposed to the external environment, and the fracture bone ends visualized and internal fixation may be used, or the fractured bone is open remote from the fracture site in order to insert an intramedullary nail across the fracture site. The fracture site is not opened and visualized. And then we have percutaneous skeletal fixation, describes fracture treatment which is neither open nor closed. In this procedure, the fracture fragments are not visualized, but fixation, for example, pins, is placed across the fracture site, usually under X-ray imaging. So here we're talking about treatments. And our objective number one says, let's differentiate between fracture and dislocation treatment types. So here we go. These are treatment types, okay? Now, I want you to turn the page in your 2020 step-by-step. It's 408. But I'm going to pull my book over so you guys can see. These are fractures. These are all the different kinds of fractures. The way that you're going to learn these, not just by reading the different types, is there will be a worksheet attached to the bottom of this lecture, and I would like for you to use that worksheet, answer the questions on the worksheet so you can learn what different kind of fractures are. For example, there's a green stick fracture. This is a bone tumor. This is an open fracture. It's really, really important for you guys to take a minute, read, study these, get a good general knowledge of what they are. Make notes in your CPT if you need to. So this is where you're going to cover that first objective, and we have talked about the treatment for these fractures. So we've covered objective number one. Again, you're going to have a worksheet that's going to help you identify different types of fractures. So the next thing that we're going to do is the next learning objective is understand types of traction. Okay, so this is where I'm going to pause for a moment, and I want to turn my CPT around, and I want to show you what I've done. I've labeled, see my tabs? Then I have general and head, humerus, pelvis, femur, leg and ankle, foot and toes. And then here I have casts, applications for casts and strapping. So I've taken the time, do you see, I've been in my CPT. I haven't done all of it, no, but I have been in my CPT today making some notes, and I am actually going to show you the notes that I made and give you some suggestions. But before we go any further, when I gave you your objectives, I listed those on Edmodo. I attached this document. I want to take a minute and I want to talk about coding the musculoskeletal system. Then we're going to get back into types of traction. So it says the easiest way to search for a musculoskeletal surgery. Number one, the name of the surgical procedure, an arthroscopy. The name of the anatomic site, humerus, and then the name of the condition, fracture. So we're having an arthroscopy of the humerus because it's fractured. So I wanted to show you because I may forget that. I'm like, I'm a forgetful lady. What if I forget what's the easiest way to look that up? Well, where my glossary is, where we started, where we're looking at our skeletal diagram, I actually wrote to search, and then I wrote these things because I might want to remember that. Maybe I won't remember later on, and maybe I want to refer to it. Well, if you look over here, this is all notes here. And if you go all the way to the end of your musculoskeletal system, you have a page for notes here. I made a different set of notes, and I'll read you those when we get there. You guys need to be marking in these manuals. You need to be making notes because you're going to remember that you wrote something down. I know I do. Okay, so we're going to talk about traction, right? Well, I just want to get back into the CPT. So we talked about musculoskeletal system, and we actually went through our treatments of fractures. Now we're going to cover our next objective, which is understand the types of traction. Well, this is what I want to show you. If you come on over, we're going to keep on going. Look at what we have here. We have tractions. So this is skeletal fixation. It's on the outside, and it's actually, this halo is attached to his skull. This is an external fixation device. Again, here's an external and another external. So understanding types of traction is actually fairly easy because it gives you an example actually in your CPT manual. Now you can see it doesn't give us much more than that, but it actually gives us some things to actually go by here. But if you turn to page 411 in 2020, I'm going to go get the 2019 book too, because that way I can tell y'all both sets of page numbers. So this will give y'all a second to go ahead and turn to that page in 2020. And let's see, 2019. Oh goodness, you guys see my 2019 step by step? I really studied this. Okay, so on page 393 of your 2019 and 411 of your 2020, these are all tractions. You see areas of the tibia, that's figure 15.3. Then 15.4 is traction is the application of a pulling force to hold a bone in alignment. So that's what traction is used for. Then on 15.5, you see skeletal traction, but in your CPT, you see skeletal traction. Skeletal traction uses the patient's bones to secure internal devices to which traction is attached. Okay, 15.6 says skin traction utilizes strapping, wraps, or tape to which traction is attached. So that is what skin traction looks like. 15.6. It uses tape and strapping. So that's our tractions. It's not any more complicated than that for traction. It's just basically those three types are the most common: the external, the skin, and the skeletal. Now, if we go back here, we look here. Skeletal traction, skin traction, external fixation. So I wanted to show you the pictures first, so that way you kind of had a frame of reference. So what I would simply do, and you see that I've underlined, but I'm actually going to highlight skeletal traction, skin traction, and external fixation. I do want to go up to here. And I'm going to turn my book around so that I can read it with you guys. This, right underneath percutaneous skeletal fixation, it says the three type of fracture, open, compound, closed, does not have any coding correlation with the type of treatment provided. Do you want to know why? Because when it's talking about if you have an open fracture, if you have a compound fracture, or if you have a closed fracture, those are actually diagnoses. Really doesn't have anything to do with the treatment, with codes. It has to do with the treatment as far as making the CPT and the diagnosis code mesh up, because you cannot code a wrist fracture with a CPT that's about the toe, right? With a procedure on the toe? No, it's the wrist, so it doesn't match up. So that's what I mean. Okay, so we talked about skeletal traction, skin traction, external fixation, correct? So I actually highlighted those. Oh, I highlighted those 3 things. Now, in my bright pink here, it says codes for obtaining autogenous bone grafts, cartilage, tendon, fascia, lattigrafts, or other tissue through separate incisions are to be used only when the graft is not already listed as part of the basic procedure. And I just wrote beside that bone grafts, because what if I need a little bit more explanation later on? I want to know that that's bone graft. Then the next little part, I'm going to turn it around because I'm not really going to read it, but it is highlighted to the yellow here. This is all about modifier 76. So I boxed it off. I wrote modifier 76 here, and I actually highlighted it yellow. And then I have something else. I have it starred, so I think it's important. Codes for external fixation are to be used only when external fixation is not already listed as part of the basic procedure. And then I just wrote external fixation because that's something a little bit more about external fixation, which was down here. Okay, and now I've done the purple. We have more definitions. So manipulation, what is manipulation? This is what it's used for, and this is a detailed description of. So I underlined that in blue. I don't know why, that's just what I did. But you can go through, and I would like for you to continue on, and I would like for you to read and highlight and make any notes that you need here. Because these things, the more you know about this page, the more you know about this section, okay? So the next thing that we're going to do is we're actually going to get into our codes. These are more our rules and regulations and things that we need to know. And I want to point out that as we come over to general, see, it's in red. General gives us a little bit about an incision here. But where we're moving to is wound exploration, penetrating gunshot, or stab wound. Now, I don't know if you've ever thought about, oh, wow, could we be coding a gunshot victim? Could we be coding someone who's been stabbed? Yeah, you're going to be coding everything depending on where you're at. So I'm going to turn this around because I want to read about wounds. So you guys can see that I did several different colors. It's because it's 3 different things to me. So 20100 through 20103 related to wounds resulting from penetrating trauma. These codes describe surgical exploration and enlargement of the wound, extension of the dissection to determine penetration, debridement, removal of foreign body or bodies, ligation or coagulation of minor subcutaneous and or muscular blood vessels of the subcutaneous tissue, muscle, fascia, and or muscle, not requiring thoracotomy or laparotomy. Okay, so that's where I stopped my yellow. Then in my orange, it says, if a repair is done to major structures or major blood vessels requiring thoracotomy or laparotomy, then those specific codes would supersede the use of these codes. Then in pink, well, this bothers me. I didn't go all the way with my orange, so I'm going to do that. So in my pink, it says to report simple, intermediate, or complex repair of wounds that do not require enlargement of the wound, extensions of the dissection, etc., as stated above, use specific repair codes in the integumentary system. Integumentary system is surface, right, guys? Maybe just a little bit under. But when we're talking about the musculoskeletal system, we're talking about down in the muscle and the skeleton. So if we look at these codes, 20100, exploration of penetrating wound, neck, chest, abdomen, flank, back, and extremity. So that is if we have to get in there and we have to open it up and we have to explore the wound, try to find the bullet hole, or we have to get some debris out of it because when they were stabbing, they got dirt in. So now we have to open that up a little bit and we have to clean it out. We have to debride all that trash out of there. We're looking at these wound exploration codes. Okay, the next is excisions. So 20150 is an excision. 20200 is the biopsy. And then I wrote biopsy here just because I know that these are biopsies. Again, we're still under the subheading general. So I just went through and made my boxes. Everything from here to here go together. From here to here go together. Biopsy 20250 to 20251, it goes together, it goes in a box together. Okay, I'm going to turn it around so you can see that a little bit better. Okay. Oh, let's see. All right, guys, I'm going to try to take you down, and I hope I don't mess up our little system just because I want to get you closer. Okay. So here, let's move you down a little bit. See, oh goodness, guys, I'm sorry. I'm going to have to hold it with this hand. So if we look at 20240, biopsy bone open, and this is going to be, let's see, I'm reading upside down, so it's difficult, I'm just saying. Okay, it says biopsy bone open, superficial, and then 20245 is deep. Okay, this isn't working. So let me go back up here. Let's see if I can get y'all set back up. I'm sorry, I apologize. I don't want to make you seasick. Oh, goodness. See, I don't like to touch it, but you know, we're learning and growing with this thing, aren't we? Okay, so that's how I have done my boxes. So 20240 and 20245, they go together, but one is superficial and one is deep. Then 20250 is biopsy, vertebral body open, thoracic, and 20251 is lumbar or cervical. They go together, but it's a biopsy in the same spot, in the same body region, but in different spots. Then 20500, injection of the sinus tract, and then 20501 is diagnostic, and these are both sinus. This is removal, and then you're going to see here where I have it circled, this is injection, 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 injection. So even though I've separated it, I know that it's all injections. Okay, I hope that makes sense how I have actually separated out. It makes sense to me. Some students in the past have drawn circles. Some people draw circles around just the, okay, I'm just going to do one just to show you. They would draw a circle around like this. Here, I'll do it on a page that I haven't. Like they would do this, like these two go together. And then they would make notes around it. I don't care for that method, but I did want to show you that. So I'm coming back over here. Now we have trigger point injection. And this has a bunch of information on trigger points. And then you're going to come over. And I've squared it off and highlighted again. Now, I've made some notes here, and I just want to talk about how important medical terminology is. And so you guys can stop this at any point and actually make these same notes that you want to make, or, you know, or pause it and kind of try to match up what I've done. And if you want to call me, let me know, or if we need to do a Zoom call and go each, one by one, we will. But I want to talk about the medical terms I've written here. I've written scopy equals study or examination. Endo means within. Arthro means joint. Otomy means surgical incision or cutting. Synthesis is surgical puncture or removal of fluid. Okay, let me tell you why I thought that was important. Let's take a look at 20600. It says arthrocentesis. Arthrocentesis. So what does arthrocentesis mean? Well, let's look down here. Arthro is joint, and centesis is the removal of fluid. So we're removing the fluid of whatever this is. Small joint or bursa. I'm trying to read upside down, guys, so I'm hoping that you're bearing with me there. So knowing what these things mean, it can tell you what an arthrocentesis is just by knowing what it means. So arthro means joint, centesis means the drawing out of fluid. So an arthrocentesis is the drawing out of fluid of a joint. So you're going to see arthrocentesis. I'm going to quit trying to say that word. Arthrocentesis. Oh, all right, that word. You guys can smile and laugh. I get all tongue-tied sometimes. So then we're moving over to our fixations, which we talked about a little while ago. So what did I do? How did I label my fixations? I didn't do it. So I'm going to stop right now, and I'm just going to choose one of my little tabs, and I'm just going to write fixation. Because if I have my book closed and I want to turn straight to fixation, I want to be able to find it quickly. So I'm going to turn my book around, guys, so that I can actually see. And I've decided that I'm going to just put fixation. Well, Marcia, where do you want to put it? Decisions. I'm going to put it on the bottom. That's where I want to put mine. Because I can see it down there, no matter where I'm at. Watch, I can see that fixation's right there. I can go right here, fixation. And actually, I know why I didn't label it. It's because it's in general, and it's just right here, but it's fine to have it labeled fixation. So, turn that over. Okay, I'm not going to go through every single one of these sections, but I did want to show you guys 20824 is the replantation of a thumb. It was a complete amputation. So these codes are really, really interesting because you're talking about if you get a limb, a finger cut off, how they're going to replant, put it back on and make it grow. And those are interesting to me. I think that that's so neat that we can do all of those things. But so here we go. Neck, back and flank, spine. Neck, back, flank, spine. I put it on my big one. Now, if all you have is the little ones, then you can write and then put them all together, however you want to do that. Keep on going. Look at all these neat things. All these neat codes, all this wonderful information. Here's some more on our spine here. T8, T9, T10. I am going to actually label that. I like that. So we're just going to have a little fun here in labeling. I'm going to label T1 through. Oh, shoot, that's not. It's T8 through T12. And I'm not going to take a lot of time to decide where I'm going to put this because. So that's literally how I do it, guys. I go through and I pick out things and I label and I highlight and I make notes. It just helps me when I start coding because then I feel more familiar with what I'm looking at. Okay, this is your abdomen and your shoulder. Abdomen, shoulder. Everything to do with your abdomen and shoulder here. See, we have some manipulation, arthrodentesis, amputation, other procedures. Okay. All right. Do you guys see humerus? And I wrote humerus on a small one right here. So I know where my humerus is. Everything to do with the humerus here. Then we have our forearm and our wrist. Okay, hang on just a minute. I have something popped up on my computer and I don't know if you guys are going to be able to see that or not. Okay, so I got it off. So here we go. So we're going to keep on forearm and our wrist. Hand and fingers. Did I miss that? I missed that. So let's stop. Oh, I need a different one than that one. Use this one. Hand. Fingers. Hope I used my last pretty pink one here. All right, so what I'm going to do is this is my hand and my fingers here, and I'm just going to put it at the bottom because I'll be able to see it when I open it up from the beginning. So I put my hand and fingers down here, see, hand and fingers. So here you have your pelvis and your hip joint. So I have pelvis and hip joint. So you guys see I've just gone through and any of the red, in the red, femur and knee joint. So I did a little one for that one. And so you're just going to continue working your way through leg and ankle, and this is your tibia and your fibula. Your foot and your toes. Okay, so this is where we want to be next. One of our learning objectives is analyze cast application and strapping procedures. Well, what's the best way to learn about those things? The best way to learn about those things is by getting in our CPT and seeing what it says in our CPT, right? So I'll turn this around. And once again, I want you guys to see that I have labeled that this is my cast and my strapping applications right here. All right, so applications of casts and strapping. Okay, I'm going to let you read that first paragraph on your own. Let me move over, I'm sorry. But I have actually, again, highlighted in different colors. So I'm going to go to the second paragraph. An individual who applies the initial cast, strap, or splint and also assumes all the subsequent fracture, dislocation, or injury care cannot use the application of the cast and strapping code as an initial service, since the first cast, splint, or strap application is included in the treatment of fracture and or dislocation codes. Okay, so what does that mean? So my son Daniel broke his wrist, went to his orthopedist, and now they x-ray it and put the cast on and everything. And so that's his initial doctor's visit. So we go back and we have to have the cast taken off to have it re-x-rayed, and they have to put the cast back on again. You're not going to get money for the cast again because it's all bundled into that original initial service, okay? A temporary cast, splint, strap is not considered to be part of the preoperative care, and the use of the modifier 56 is not applicable. Additional evaluation and management services are reported only if significant identifiable further services are provided at the time of the cast application or strapping. And I'm going to let you guys read the rest in purple and make your notes, highlight, underline, whatever speaks to you. And then at the bottom, we have body and upper extremity. This is casts, splint, and strapping of any age. So then here are the lower extremities: casts, splints, strapping of any age. Then we have removal or repair. Codes for cast removal should be employed only for cast applied by another individual. Okay, so Daniel went to Dr. Orthopedics and got his cast on, but we made an appointment to see another doctor, different doctor, not Dr. Orthopedic, let's call him Dr. Cast. So Dr. Orthopedic put it on, but Dr. Cast is going to take it off. Dr. Cast gets to charge for taking that off. But if we went to Dr. Orthopedic, it's actually bundled into the cast application. So here are all your cast removal codes. All right, so our last thing that we're going to talk about is endoscopy and arthroscopy. Now, if you wrote down your medical terms, let's see, how far back do I need to go? I guess I need to put medical terms on a tab, huh, guys? One more, here they are. So endo means within, so arthroscopy and endoscopy. Within a study of inside, and arthroscopy is the study or the examination of a joint. So arthroscopy and endoscopy, and I have a little bit of information that I'm actually going to read here. As nouns, the difference between endoscopy and arthroscopy is that endoscopy is the examination of a bodily orifice, canal, or organ using an endoscope, while an arthroscopy is the examination of the interior of a joint, such as a knee, using an arthroscope. Arthroscopy is percutaneous endoscopy because it requires only a small incision in the skin through which the instruments are inserted to reach the view and procedure site. Percutaneous access is used to stabilize unstable fractures without open surgery, including vertebral fractures due to injury or cancer. So these are endoscopy, arthroscopies, and I have some highlighting here. Surgical endoscopy, arthroscopy always includes a diagnostic endoscopy or arthroscopy. When an arthroscopy is performed in conjunction with an arthrotomy, guys, you got to watch your otomies and oscopies and estomies and otomies and all of these things. You have to make sure that your wording is correct. In conjunction with an arthrotomy, add modifier 21. So it's just giving us some extra information about coding. All right, and so here I wrote the definition of endoscopy and arthroscopy. And I'm going to read that to you because it is different than what I read to you on the paper. I like reading things in several different ways. Okay, so an endoscopy, procedure to look inside of the body, uses an endoscope to examine the interior of a hollow organ or cavity of the body. Endoscopes are directly inserted into the organ, and there are many types of endoscopes. Arthroscopy, surgical procedure doctors use to look at, diagnose, and treat problems inside a joint. So I'm going to turn that around and just let you see that I've written this in my notes. All right, so we're going to go back to the musculoskeletal system. Oh goodness, I'm trying to go all the way back to integumentary, guys. Nope, we're done with you, Mr. Integumentary. So I just want to point out how my labeling looks when I open up. Have my neck. Let me just set it a little bit. See my neck, my abdomen, my forearm and wrist, applications for straps and casts. And then if I come over here, look, I can see my general, my head, my humerus. This is where the T8 through the T12 was, my pelvis, foot and toes, hand and fingers. Here's my fixations. See, I can see all the things I need. All right, so I hope you guys enjoyed that. I hope that you learned a lot. I do want to go back. I'm sorry, I am trying to get rid of y'all too quickly. I don't want to do that. I want to show you your worksheets. So this is one of your worksheets you'll be doing today, and it's going to be giving you some extra definition on your fractures. And again, you're going to have types of fractures. This is the other sheet. If you can't print this off, don't worry. Just do it on notebook paper. Take a picture of it and send it to me. This is how we're learning our fractures. And again, if you look in your book, there's all kinds of information on fractures. You're going to need to read each section of your step-by-step manual, and I'm going to be assigning you guys your exercises. So also, one more thing, you have this sheet. Again, if you cannot print it out, that's fine. These are main terms that you're going to be looking for when you're actually coding the musculoskeletal system. And it lines up very closely to what we were just talking about, or the sections that we went through in our CPT. This is your assignment. I want you to define the word eponym. E-P-O-N-Y-M. Eponym. I want you to submit that along with done. All right, guys, have a great afternoon, and I'll talk to you soon.